This evening, this is Jenny Healthcare. I want to highlighting us on opportunistic infection. Opportunity infection is those infection that results as a complication of AIDS. It comes once the opportunistic infection comes in, you know that the person has gotten to the last stage of HIV, which is acquired immune deficiency syndrome. These are this opportunity infection can be virus, can be bacteria, it can be fungi, it can be parasites, it can be anything. They takes advantage of the weakened immune system. That is, the immune system is the system that um, protects us, that fights against any dangerous disease that comes to our body. So when it is weakened, that is when the person will come down with AIDS. So what are some of these opportunistic infections? First of all, we have fungi infection. That fungal infection can be candidiasis, especially for women. It can be pneumocystic varicose pneumonia. This is the last stage that damages the lung. At that stage, the person will be having difficulty in breathing. That is the last complication, and so on and so forth. We have bacterial infection. That can be tuberculosis. That is Nibwana Bioqualanta. We have mycobacterium alveoli complex, and so on and so forth. Then we have a viral infection. Viral infection can be cytomegalovirus. This is what causes blindness in patients with AIDS, and also uh, damages other organs. And you have herpes simplex. That herpes simplex can lead to skin ulcer, can lead to or stomach ulcer, and so on and so forth. Then we also have parasitic infection. That parasitic infection, we have toxoplasmosis. That is a parasite that affects the brain and causes confusion. That's why you see them in AIDS. They will have that confusion because they have this toxoplasmosis infection. We have cytopyrodosis. That is the infection that affects the intestinal organ. The parasite lives in intestinal organ. That's why you see them. Somebody with AIDS will be purging, will be stooling constantly, diarrhea, serious diarrhea that can kill them. Then we have HIV related cancer. That is, the person can have this sarcoma, the person can have a lymphoma. That is, especially for women, they normally come down with this cervical cancer. This cervical cancer, then we also have a HIV encephalopathy. The person will come down with damage to the brain cell and will still be talking irrational. That's the end stage. Then the next thing I want to talk about is the nursing intervention. The nursing intervention, how do we care with this patient with opportunistic infection? Remember, they have gotten to the stage of AIDS. I've gotten to the stage of AIDS. So the AIDS is like their last stage. That's the person did not manage, because if you are taking your drug adequately, I don't think you can get this you can get down with this opportunistic infection. But remember, AIDS is the complication, that is the consequences of HIV for not taking care of yourself. We have the first one is immediate care and treatment. That is monitoring closely of the patient signs and symptoms of the infection to make sure you manage it so that it won't worsen. Then we have initiate and adherence, making sure that the patient is totally and strictly adhering to his or her drugs. Patient must totally adhere to his or her drugs. That is number two. Then number three is symptom managing. That is addressing some symptoms that are damaging to their organ, like fever, like fatigue, like weight loss. Making sure that the patient eats adequate nutrition and taking care of the person. Then the second one is patient's education. and support. You have to be educating the patient. That is the most important thing. Educating the patient, that is by providing clear education on what is this antiretroviral drug is, because some of them don't take it serious. They don't know that if you don't take your drug, you can't stay healthy. So some of them doesn't take it serious. So you have to educate them. Let them know that if they mix this drug at this certain hour, the drug that the person has missed is consistent. So the person have to be consistent with the drug. Then risk reduction, teaching the patient how to reduce risk, especially for male or for female, how to avoid having sex without condom, how to take care of the person so that the risk will not generate more. That is reducing the risk. Then psychological support, trying to give the patient support that will make him or her to live longer, because some of them will think, soon I will die, what this. But with that psychological support, trying to educate the patient will be able to take care of him or herself. Then the third one is prevention of long term care. That is future opportunity, implementing strategy like appropriate immunization. That is inactivated vaccine. That will be with the immunization, the patient cannot get it like that. The immune is covered. And lifestyle modification, the kind of life the person live to support strong immune system. Then secondly, maintaining healthy lifestyle. That is the person not also ought not to be living anyhow. You eat adequately, eat what you're supposed to eat, then you live a lifestyle, though you don't smoke, you don't drink, all the kind of lifestyle that will help you to be prone to this infection. You live it, you eat what is supposed to eat to avoid wasting syndrome. That is, the person will be losing weight, or sometimes the person can get adequate weight from that ART, which is not good. Then finally, to promote infection, that is reinforcing safe practices and sexual health education. Reinforcing safe practices, like sometimes you see them, they will create awareness, sharing condom in the road and all those things, giving safe health practices, especially to the young teenagers who have sex without protection, telling them what it means to have this HIV/AIDS, then to prevent the transmission of HIV and other infections. Well, this is where I will stop. I just want to let you know that Jenny Healthcare cares. And also, just do like, comment, and share to support my to support my missionary journey. Thank you very much. I love